I very much enjoy referring to Dr. Shirazi for a number of reasons. Primarily, he's a very personable doctor, and that establishing that doctor-patient relationship is really key to get the best outcome, and David does that exceptionally well. The clinical side of what Dr. Shirazi provides is an alternative to the rather standard MD referral to a specialist who will supply a pressurized oxygen delivery for sleep apnea. And the option to have a bite adjustment is something most patients are not even aware of. And this is one of the strengths in Dr. Shirazi's practice. When patients discover they can actually use a bite appliance to adjust their jaw position at night and improve their airway opening and improve their sleep habits and improve their oxygenation and never have to use the pressurized device, this is an amazing treat for those people who are appropriate to that. And there are many people that's sufficient therapy for them. Occasionally additional oxygen delivery is needed as well as the bite adjustment. Typically I refer a patient who is snoring and has disrupted sleep and isn't sure how severe the disruption to their sleep pattern is. So one advantage of Dr. Shirazi's approach is that he can start with a portable sleep monitoring device in the patient's home in their own bed. Most patients love that rather than having to go to some strange location where there's a sleep lab and they have quite a few wires hooked up to their head. And suffice it to say, this is not going to reflect a usual night's sleep to start with. So I think the portable sleep device, sleep pattern measurement at home is really a much more accurate reflection. I'm also a patient of Dr. Shirazi's, so I have firsthand experience of his bedside manner, his diagnostic skills, and also his therapeutic approach to me, which I find very enjoyable to come here. His staff are really excellent, friendly, and they work well with me. So it's not the kind of thing that people might expect in terms of having to put an appliance in your mouth, and Dr. Shirazi's staff are very understanding and patient with getting things just right. So the symptoms that brought me in included, well, starting off with my wife who wasn't sleeping well because I wasn't sleeping well, and those reasons included restlessness at night, getting up a few times, snoring, and then when I did the home oxygen, the home monitoring device, I found that my oxygen was dipping quite low. So after I did was fitted for the appliance here with Dr. Shirazi and started wearing that at night, I actually improved to the point where I don't snore and I sleep soundly through the night, except maybe getting up once. And also the oxygenation is improved because the airway diameter has increased. So those are basically, I'm a good success story for Dr. Shirazi because his therapies worked for me without having to use the supplemental oxygen device. Traditionally, there were fewer choices available. There may be only one sleep expert in the community, there may be none. And so the first stop is usually the pulmonary doctor, lung specialist, because of the drop in oxygen at night. So the pulmonary doc would supply a pressurized device that the patient would have to apply at night. And unfortunately, some of those devices actually cause more loss of sleep just because of the noise and having to put the appliance on and that sort of thing. And they also affect the spouse, who's also wanting to get a good night's sleep. So I like starting with Dr. Shirazi because he basically agrees with my own philosophy as a physician, which is to go with less invasive techniques first and gradually working up to more invasive. So starting with the mouth appliance and a jaw adjustment is clearly the place to start. And Dr. Shirazi does this so well. What I usually tell patients is, we're so fortunate to have Dr. Shirazi here in Thousand Oaks. You might normally find somebody like him in a university environment. but here he is in private practice. So we're really blessed in the community to have him here.